Dr. Sarah Wakeman, with all the work that you do, what is the mission that you are on?
My mission is really to change the way people think about and understand alcohol and drug problems, and also to give people the evidence and the facts, both to understand addiction, which are sort of problems related to alcohol and drug use, but also to just understand the science around, for example, how much should you drink? Is drinking healthy? Is it not healthy? There's a lot of misinformation out there, and I want to give people the tools to make the right decision for them in their lives.
And who are you and what is your sort of body of experience and
Yeah.
education?
So I'm a medicine doctor by training. So I still do some general medicine, like in the hospital, take care of pneumonia and heart failure, and in the outpatient setting, take care of people's diabetes and depression. But I train especially in addiction medicine. So I'm board certified in addiction medicine, and that's been kind of my life's work. I work in a big academic medical center in Boston, Massachusetts, where I would say my kind of focus professionally has been thinking about how do we bring addiction care back into the medical system so that it's not this separate and unequal and often very poorly done sort of siloed system, but actually just a part of the healthcare that people get. And then I train people. So I'm program director of our fellowship program. So I train doctors who want to be specialists in addiction medicine.
When you think about how we treat addiction in the modern world, what are some of your gripes? Where are we going wrong?
Oh, how much time do we have?
I think I enough. Yeah.
Where do we begin? I mean, I think at its core, the biggest problem is that we've all been taught and sort of infused in this idea that addiction is an issue of behaving badly,
Mhm.
that it's an issue of morality, that people really need to kind of knock it off and pull themselves up by their bootstraps, and that this is like a criminal legal issue, that it's an issue of willpower. And so if you believe those things, then why would you think that someone should get medical care? Or why would you treat them with compassion and kindness if you think that they're doing something wrong?
Mhm.
And so really reframing how we think about addiction based on all of the science we have and what effective treatment looks like, which often is very different than what people may have experienced if they were trying to access care for themselves or a loved one.
And what is an addiction?
Yeah.
What falls into the bucket of addiction? You know, because I use my iPad a lot, I use my phone a lot. Um, is that an addiction?
Yeah, it's a great question because we use that term colloquially a lot. I'm addicted to Netflix or whatever. So addiction is really defined by use despite consequences. So continuing to do something in your life despite bad things happening to you because of it.